welcome to another episode of THB's podcast. Thinking from a physician's perspective, how can we close the gap between a physical examination being conducted through a clinical assessment or clinical telemedicine? That's what a physician's concern would primarily be. How can we cover that gap?
Well, first of all, there are many specialties where physical examination is not of paramount significance. Take example of psychiatry. That is again an area where a lot of conversation is needed, and thinking of the convenience to the patient and to the consultant and to the whole health industry, telepsychiatry is one of the areas where a lot of things can be done. Then there are many other specialties where the reliance on the investigations, the blood tests, is very heavy. Clinical decisions are pending blood test results. So which means that if the patient has the blood test result conveyed electronically through the clinical telemedicine system, the doctor is able to make a decision during a call. So that is like endocrinology, like audiology, like, for example, take other specialties. Even if you take ophthalmology, a lot of retinoscope results, the ophthalmologists are waiting for retinoscope results to confirm their visual findings. So these results at times are only required after a physical visual examination. And then comes those investigations where we make clinical decisions only on the investigations. For example, orthopedics, X-rays, MRI scans, cardiology, echocardiograms, ECGs. So there is a heavy reliance on medical information in the form of investigations, which can all be part of the electronic medical record system. One thing I want to mention here, there is a text or data-based electronic medical record. But in our clinical telemedicine system, we have put a portal where there's a video and also image-based electronic medical records. So a patient can send a clip of a child limping to me. My mothers do that when I do in my practice. My child is limping. So I examine their gait in a far more repetitive way. I have an opportunity to analyze that at still frames as well. That where is the child exactly limping? So this advantage of having video calls plus the information in imagery and videos. For example, if a person sends me a picture of a skin rash, or I can take the picture live during a consultation. So this advantage to physicians is enormous, and they must not lose this by just video calling.
I hope you enjoyed this segment today. Stay tuned for more from the Health Bank Global.